there's Ryan Kessler. He is in big trouble. He was on the attack, on the offense, trying to chase down Dan Boyle. Let's see what happens here. It's just like he pulls up lane. All of a sudden he pulls up lane. He wasn't hit. He limped all the way to the bench, obviously.
Season's thrilling and heartbreaking Stanley Cup run, the main news to come out of the Canucks camp was the information that star forward Ryan Kessler had torn his acetabular labrum and was to undergo surgery to repair it. With many fans unfamiliar with the surgery and the injury itself, we decided to investigate further to come up with some answers. Before we begin, we thought we'd test you with your knowledge you have already about acetabular labral tears. So, can you answer the following questions of what is the labrum of the hip joint and what is its function? 2, how do you tear a labrum? And 3, what is arthroscopic surgery? Please write down your answers on a piece of paper. And for our 4th question, we'd like you to get out your eye clickers and answer either A, yes, or B, no to the question, should Ryan Kessler get immediate surgery to repair his torn acetabular labrum? Now that you've had a couple of minutes to think about the results, let's look at what the class thinks so far. As you can see, it's pretty split. Keep this question in mind as we will revisit it later on after you've learned a little bit more about our presentation. So, the learning objectives for today's presentation is for you to be able to answer the following 2 questions when we're done. 1, list the 2 categories, 4 symptoms, and 3 diagnostic tools of an acetabular labral tear. And 2, confidently answer the question was whether immediate surgery is the best possible treatment option for an acetabular labral tear. First, here's a bit of background information on the hip joint and the labrum itself. The hip is a ball and socket joint consisting of the acetabulum, the socket, and the femoral head, the ball. Both the acetabulum and the femoral head are covered in articular cartilage, providing the joint with cushioning and stability. The labrum exists inside the joint as a ring of avascular fibrous cartilage surrounding the acetabulum, where it is attached to the acetabular ring. It is non-uniform in composition, as it is thinner anteriorly and thicker posteriorly.
So, what is the function of the acetabular labrum? Well, for starters, it stabilizes the hip joint by deepening the joint socket by up to 21%. It protects the bones and regulates bone inequalities. It also decreases contact forces by increasing the surface area over which a load would be distributed. It acts to decrease friction forces at the hip joint by 92%. And lastly, the acetabular labrum assists in preventing the femoral head from subluxing. So on to labral tearing. What kind of tears exist and who is at risk? There are 2 categories of labral tears. One being degenerative, which is caused due to repetitive use and activities accumulated over wear and tear. A traumatic tear would occur via an acute injury, either due to hyperflexion, hyperextension, hyperabduction, or in the case of a fall or accident. So with these 2 types of tears in mind, who would be at risk for tearing their acetabular labrum? People who participate in activities involving frequent lateral external rotation, hip flexion, and twisting. So some examples of these people would be hockey players, soccer players, dancers, and golfers. You might be wondering, how would you know if you've torn your acetabular labrum? There are some key symptoms that arise indicating a tear. One would be pain in the anterior thigh gluteal region and greater trochanter. Also, 87% of patients report feeling pain in the groin area as well. Another indication is decreased range of motion in the hip joint, as well as pain at 90 degrees hip flexion through both active and passive movements. Lastly, a number of patients will describe a locking and or clicking of the hip joint. So there are 3 diagnostic tests to confirm whether there's been a tear at the acetabular labrum. Firstly, the flexion, abduction, external rotation, or Faber test, shown in this image here on the right. The patient would assume this position as the examiner applies pressure to the knee of the affected leg and notes whether there is any pain detected. A similar test is the provocation test, where the examiner flexes the patient's affected hip to 90 degrees and then internally rotates while adducting the hip to see if any pain is elicited. Lastly, would involve using an MRI, but this is not a preferred method. It is a poor diagnostic tool for acetabular tears, and in one study missed 55% of labral tears and only gave a correct diagnosis in 4% of the cases. In conclusion, for diagnoses, there is no radiographic technique that is currently reliable in detection.
All right, so after fully reviewing treatment options, we have decided that arthroscopic surgery is currently the best treatment available. Arthroscopic surgery is fairly non-invasive, and it's a procedure that only takes 30 to 40 minutes. The surgeon makes several small incisions into which they put a microscopic camera and several tools to complete the surgery. The goal is to both remove any loose fragments that are near the joint, as well as trim and repair the torn labrum. So, as you can see from the pictures, there's a drastic reduction in scar tissue, as well as detached labrum post-surgery. So, exactly how did we come to the conclusion that surgery is the best option? Firstly, we used our logic. So, returning to activity will of course require the same type of movements that caused the injury in the first place. Without complete reparation of the torn labrum, it is possible that you could do greater damage. This is especially important for an athlete in which the recovery is time sensitive. Secondly, we of course used research. In a systematic review of 26 studies, as many as 89% of patients reported relief of their mechanical symptoms and pain post-surgery, 2 years post-surgery. In another study by Huffman et al., 91% of 86 participants claimed a high rate of symptomatic relief post-surgery. This led to Huffman labeling arthroscopic surgery as the gold standard for labral tears. A final study claims that arthroscopic treatment is a good short to mid-term treatment option. The one downfall to this type of surgery is that it is relatively new. Therefore, we don't really know the long-term effects of it. However, in terms of short-term effects, it really is the best option that is currently available. One final point that I should mention is that arthroscopic surgery allows the doctor to go in and microscopically examine the hip. This allows them to detect the amount of damage that is currently there, which allows them to find out the best means of reparation for the hip. All right, so why exactly are drugs and rehab not a good option when surgery is? A major point is that without proper treatment, labral tears may lead to further damage, including chondral damage, further hip pain, or osteoarthritis and joint degeneration. Rehab entails physical therapy, which aims at both strengthening the muscles, but also at eliminating exposure of the damaged hip to the type of movements that caused the injury in the first place. This type of physical therapy isn't ideal for an athlete in which it's not feasible for them to just stop playing. It was also concluded by Hickman and Peters that physical therapy has not proved to be a significant benefit and is not recommended for patients with labral tears. Finally, NSAIDs are of course a way to reduce swelling and to alleviate symptoms, but they are by no means a permanent treatment. Now it is time to revisit the questions that we asked you at the beginning of class. Hopefully, after listening to the presentations, you can answer these questions with ease. What we'd like to focus on is the fourth question again, and we will get you to get out your eye clickers once again, and we'll see if after the presentation you have learned a little bit more and can answer this a little bit more efficiently. So let's see these results. Ah, perfect. All right. so it's exactly what we wanted. It shows that you did learn that surgery is the best option for an acetabular labral tear. In summary, if Kessler were still attempting a rehab program, he would not be able to work out to look as good as he does naked. But more pertaining to our actual subject, a labral tear can either be degenerative or traumatic. The symptoms include anterior thigh, gluteal, and greater trochanter pain, a decreased range of motion, pain at 90 degrees flexion, as well as locking and clicking of the joint. Injury can be diagnosed via the Faber and the provocation tests, or an MRI or MRA. And finally, surgery is the best option over rehab, as it leads to greater patient satisfaction, symptomatic relief, and more rapid return to activity. So we'd like to thank you for listening.